Smoking pregnancy, the effects of smoking on mothers and infants. Cigarettes and cigars are both made from rolled tobacco leaves. The addictive substance nicotine is discovered in tobacco. Cigarettes contain a highly addictive substance called nicotine. An addict's brain will make him or her smoke even if they don't want to. An individual's willpower and capacity to quit smoking are both diminished by addiction. How is smoking harmful to your body? If you continue pregnancy smoking, you and your unborn baby are putting yourselves at greater risk for serious health problems. The risks to both you and your unborn child from passive smoking are substantial. Research conducted in 2019 found that over 10% of pregnant women in Australia were smokers. There is a correlation between cigarette smoking during pregnancy and premature delivery and low birth weight. The risks to mother and child can be reduced, however, if smoking is avoided or cut back significantly. If you and your unborn child want to avoid the baby's risk associated with smoking, quitting as soon as possible after becoming pregnant is your best bet. On the other hand, quitting smoking at any time reduces health risks. How can smoking harm your pregnancy? Preplacental hemorrhage. The placenta, which develops during pregnancy, is a vital organ that carries oxygen and nourishment to the developing baby. Multiple placenta-related problems are strongly associated with smoking during pregnancy. Placenta abruption is a potential issue. Preterm placental separation is a condition in which the placenta becomes detached from the uterus before the baby is born. Severe bleeding from a placenta abruption might endanger the lives of both the mother and the child. Unfortunately, there is no cure or operation that can fix this. There is still hope for a successful delivery, even with placenta abruption, if you seek medical assistance right away. Congenital placenta malposition. Placenta previa is a danger for pregnant women who smoke. Normal placental development occurs towards the uterine apex throughout pregnancy. As a result, the cervix is ready to open for birth. When the placenta does not move up into the upper uterus but instead remains in the lower uterus, partly or completely covering the cervix, this condition is known as placenta previa. Having the placenta rupture may lead to severe bleeding and deprive the unborn child of oxygen and nutrition. A premature birth. Smoking during pregnancy has been linked to premature delivery, as reported by the CDC. The term for when a baby is born before its time. Premature delivery is related to several negative health outcomes. Examples of such things may be disabilities in sight and hearing, disability of the mind, disruptions in education and behavior, problems that might be fatal health problems, a low weight. Low birth weight baby is another risk when mothers smoke during pregnancy. Having a young baby is not the only possible outcome. Another health issue and disability that may result from a low birth rate is an unhealthy pregnancy. As medical technology has improved, the percentage of babies that die at delivery as a consequence of their weight has decreased. This does not diminish the fact that it is a potentially fatal disease that may lead to prolonged childhood illness associated with delay in development. Hearing or vision impairments, cerebral palsy. How can smoking affect your baby? Cigarette smoke contains a variety of substances, including nicotine, carbon monoxide, and tar, all of which may be transferred to the developing fetus through the placenta and umbilical cord. There is evidence that certain substances may cause damage to your developing child. They have the potential to reduce your baby's oxygen intake. This may harm your unborn child's lung development and brain development. There is an increased risk that your child will occur before the 37th week of pregnancy. Cleft lip and cleft palate, both of which affect the baby's mouth, are examples of birth deformities. Defects in a baby's health that were present at birth are called congenital disabilities. They alter the form or function of a body portion or parts. Issues with general well-being, physical growth, or function may all stem from birth abnormalities. Miscarriages. Sadly, prenatal deaths such as miscarriages and stillbirths are all too common. pregnancy losses before 20 weeks are considered miscarriages. A stillbirth occurs when a baby dies before delivery after 20 weeks of pregnancy. SIDS. Suffer from SIDS and perish as a baby, also called SIDS. For babies, the risk of SIDS increases while they are sleeping. The baby often dies while sleeping in his crib, thus the name. Tell your doctor if you smoke and are pregnant or trying to conceive. Help with quitting is available from your provider. What is secondhand smoke? Does it affect baby? Smoke from a cigarette's flame plus the smoker's exhaled smoke makes up secondhand smoke, also known as passive smoke or ambient tobacco smoke. More dangerous compounds such as tar, carbon monoxide, nicotine, and others may be found in the smoke released from the burning end of a cigarette or cigar than in the smoke breathed by the smoker. Secondhand smoke may be harmful at any concentration. Children and infants who breathe in secondhand smoke have a higher risk of developing asthma, allergies, and lung and ear infections. Stale smoke seeps through cracks and beneath doors. Babies with respiratory issues might have their symptoms exacerbated by even short exposure. Smoking and breastfeeding. Breastfeeding is good for your baby in many ways, and it may help chronic disease prevention such as respiratory ailments, gastrointestinal problems, and even ear infections. It is beneficial to refrain from smoking when nursing. Smoking during nursing may lead to a variety of complications. Some compounds in cigarette smoke, including nicotine, may be transferred to a nursing infant via the mother's milk. The quantity and quality of breast milk produced by a nursing mother who smokes might decrease. If you smoke while nursing, your infant is more likely to have health issues, including colic and sleep disruptions. Women who smoke have a lower rate of breastfeeding and a higher rate of early weaning compared to non-smoking moms. When quitting smoking proves difficult, try these strategies. Avoid smoking in the hours leading up to and including meal times. If you want to give yourself the most time to eliminate nicotine from your breast milk, you should nurse your infant first and then smoke, so whether you're trying to kick the habit using a nicotine lozenge, mouth spray, gum, or inhaler. If you must smoke, please do it outside and away from your child for disease control. Conclusion. It's bad for your health and a serious addiction to smoking cigarettes. If you want to lessen your chances of developing cancer or any number of other diseases, quitting smoking is a good place to start. Premature birth and birth defects are just two of the many issues that can arise. Your child is at a higher risk for sudden infant death syndrome as a result. Do not smoke during pregnancy, and avoid exposure to secondhand and third-hand smoke as well. Tell your doctor if you need help quitting smoking. If you want to stop smoking and stay smoke-free, creating a quit plan will keep you on track. Both you and your unborn child will benefit from your immediate abstinence from smoking and avoid pregnancy complications. FAQs. Is it safe to use e-cigarettes during pregnancy? No. Both you and your unborn child are at risk from the chemicals found in e-cigarettes, such as nicotine. You and your unborn child could be harmed by the chemicals and flavorings used in e-cigarettes. The vapor from an electronic cigarette can be harmful if inhaled. The effects of e-cigarettes on pregnant women and their unborn children are not well understood at this time. Can you just cut down on smoking? Or do you have to quit? Tobacco products labeled as light or mild may seem like a better option during pregnancy. That is not the case. Maybe you don't want to quit cold turkey, but you do want to limit your smoking. As you might expect, the less you smoke during pregnancy, the better it will be for your child. However, you'd be better off giving up. Both you and your unborn child will benefit from your immediate abstinence from smoking. If you like this video, make sure to give it a thumbs up, and also subscribe to my channel for more informative videos like this one.